Hello and welcome to Biochemical. Today we are exploring 15 major facts about diabetes, along with its biochemical basis. Let's begin. Fact 1. Diabetes is a chronic metabolic disorder characterized by elevated blood glucose levels resulting from defects in insulin secretion, insulin action, or both. Fact 2. There are two major types of diabetes. Type 1, diabetes results from autoimmune destruction of insulin-producing beta cells. Type 2, diabetes results from insulin resistance combined with impaired insulin secretion. Fact 3. Type 2 diabetes accounts for about 90% of all diabetes cases worldwide. Fact 4. Early symptoms may include increased thirst, frequent urination, fatigue, unexplained weight loss, blurred vision, and slow wound healing. Fact 5. Many individuals with type 2 diabetes may have no symptoms for years, which is why regular screening is important. Fact 6. Obesity, physical inactivity, unhealthy diets, and family history significantly increase the risk of developing type 2 diabetes. Fact 7. Insulin is the major hormone responsible for moving glucose from the bloodstream into the cells for energy use or storage. Fact 8. Long-term uncontrolled diabetes can damage multiple organs, including the eyes, kidneys, nerves, blood vessels, and heart. Fact 9. Diabetes significantly increases the risk of heart disease, stroke, and peripheral vascular disease. Fact 10. Proper diagnosis includes fasting blood glucose tests, oral glucose tolerance tests, random glucose tests, and the HbA1c test, which measures long-term glucose control. Fact 11. Lifestyle changes such as weight management, healthy eating, and regular exercise can delay or prevent type 2 diabetes in high-risk individuals. Fact 12. Treatment may include lifestyle changes, oral medications such as metformin, and in advanced cases, insulin therapy. Fact 13. Monitoring blood glucose regularly helps prevent complications and guides treatment decisions. Fact 14. Diabetes is closely linked with metabolic syndrome, which includes abdominal obesity, hypertension, high triglycerides, and low HDL cholesterol. Fact 15. With early diagnosis and comprehensive management, many individuals with diabetes live long, healthy lives. Biochemical basis of diabetes. Now, let's briefly look at the biochemical basis of diabetes. Diabetes develops when the balance between insulin production, insulin action, and glucose regulation is disrupted. In type 1 diabetes, autoimmune cells attack the pancreatic beta cells. As these cells are destroyed, insulin production drops to very low levels. Without insulin, glucose cannot enter most cells and instead accumulates in the bloodstream. In type 2 diabetes, the primary problem is insulin resistance. The body produces insulin, sometimes even in high amounts, but the cells do not respond effectively. As a result, more insulin is required to move glucose into tissues. Over time, the beta cells become exhausted and fail to keep up with the demand, leading to rising blood sugar levels. At the biochemical level, insulin resistance is strongly linked to elevated free fatty acids, chronic inflammation, mitochondrial dysfunction, and oxidative stress. These factors interfere with insulin signaling pathways inside cells, especially in muscle, liver, and fat tissue. In the liver, insulin resistance leads to increased glucose production, even when glucose levels are already high. In muscles, reduced glucose uptake contributes directly to hyperglycemia. In adipose tissue, excess fat breakdown releases more free fatty acids, which further disrupt insulin signaling. Chronic high glucose levels cause the formation of harmful molecules known as advanced glycation end products. These compounds damage blood vessels and accelerate complications such as neuropathy, nephropathy, retinopathy, and cardiovascular disease. Generally speaking, diabetes reflects a breakdown of the tightly controlled biochemical systems that regulate energy use, hormone balance, and metabolism. In conclusion, it's apposite to state that diabetes is common, but with the right information and proactive management, it is controllable and its complications are largely preventable. Our understanding of the facts and the biochemical mechanisms behind this disease helps us make informed decisions about our health. Thank you for watching. If you have questions, drop them in the comments. Remember to like, share, and subscribe to Biochem Plus.